This PowerPoint is about how to chart medications in EHR Tutor. Specifically, we will go over how to chart parenteral meds, inhaled medications, injections, and IV fluids and medications. When you're in your patient's chart, open the chart and click on the MAR, the Medication Administration Record. The initial steps of going through the MAR are covered in the oral medication lecture. Please review this information if you need to. So basically, when you open it up, it will open to the patient summary, and in the menu to the left, you will find the tabs to click through and navigate the sections of the chart. About midway down, click on the Medication Administration Record, MAR, and that will take you where you need to go. In the MAR, the medications ordered will be listed according to how they were ordered. The scheduled meds are listed first, and the PRNs are listed after that. A scheduled med would look like what you see on your screen right now. It is the drug fluticasone, and if you look over across, it is scheduled at 7 a.m., scheduled at the time you're supposed to give it. So any med that's scheduled will have that word scheduled at the time it is supposed to be given. The PRNs, however, will just have blank spaces in the time column, and you will need to choose the appropriate time, click on it, and chart from there. If you click on the word scheduled for fluticasone at 7 a.m., this box pops up, and you can use it to document the details of your medication administration. Please note that there are two pieces of information under the name of the medication. Here the name is fluticasone. The first bit of information you see is the order, and that will include the dose, the frequency, the scheduled time, if it's appropriate, and the route. Under that, it will give you the start date and the stop date, if appropriate, and how the medication is dispensed. Now, what is dispensed may be different than what is ordered. This is a very important detail. In this case, the order is for puffs because the dose for a metered dose inhaler of this medication is a standard amount of milligrams. Back when you looked at oral meds, you may have noticed that there would be a dosage, and then what is dispensed may be less than that dosage, and so you would have to give multiple tabs of what was ordered. So this is the same format no matter what route the drug is ordered. You can refer to the oral medication presentation if you need a refresher on the details. So if you look at this slide, you'll see that the amounts dispensed is an inhaler, and it is 0.44 milligrams per inhalation. If you chart this medication when you give it, you enter that you gave the dose, so given would be under actions, and then again the date and time will pre-populate just like it did in the oral medications. And then the dose is not milligrams in this case, it's puffs because they order one puff. And then comments can be put in if there are abnormal things that you need to talk about, perhaps the SpO2, breath sounds, respiratory rate, whatever you may need here if it's abnormal. If it's normal, usually nothing else is needed. Here's a medication given that is an inhaled medication, but it's given with a nebulizer. It is given PRN for a purpose, and if you look at the order on the slide down at the bottom under albuterol, it will say given per nebulizer for wheezing, dyspnea, or an SpO2 less than 90%. Now the reason for administration and the assessment data, both before and after, can go in the comment box. These may also be elaborated on in a nursing note or on the vital signs graphic, depending on what the parameters are. So if it's an SpO2, that could be on the vital signs graphic. If it has to do with abnormal breath sounds, perhaps use of accessory muscles, that sort of thing, that could be in a nurse's note. So if you look at the order here, you can see that the albuterol is ordered Q6 PRN, so there'll be no scheduled time. You'll just click in the empty space when you want to give it. So in this example, let's say 10 a.m. is when you're going to give it. So your action will be given, the date and time pre-populate, and then it can be given in a number of clinical situations as we discussed, and then you can use the comment section to describe why you gave it and how things changed or didn't change after administration. The dose here is 2.5 milligrams. Now you'll notice it's dispensed as nebulizer solution for inhalation, 2.5 milligrams in 3 mils. There's really no way that you can write the 3 mils in here, and that's a very standardized dose, so the 2.5 milligrams is sufficient here. The other blank would be rate, and that doesn't count here for nebulizer. And so after you've charted this, click update and your medication will be charted and you're set to go. For injections, no matter what type of injection you're giving, IM, sub-Q, or intradermal, the site of injection is important, and that can be recorded in the comments section. We will use insulin as our injection example here. It can be ordered as a fixed dose at a scheduled time, with a sliding scale dose at a scheduled time, or PRN. We will talk to you a lot about this in lab and in pharmacology, so if you haven't learned about it now, don't worry about it. I just wanted to use this example to show you how the orders pre-populate. So if you have a sliding scale, which means the dose you give is based on the patient's blood glucose, the scale will always be written in the order and it will always pre-populate in the MAR. For sliding scales, the glucose level should be in the comments section, and it may also go in the vital signs graphic as there's a space for it in the EHR Tutor. So let's look at our slide here. If you click on scheduled for LizPro at 7 a.m., this box pops up. If you look at the dose, it says other, see administration instructions. And if you look down below, you will see the sliding scale. It will list the range of blood glucose, and then next to it, the number of units of LizPro insulin you give if the person's blood glucose falls in that range. So you go back up and you'll see the schedule, the times 7, 12, 7, and 10. The route is sub-Q. It's dispensed in 100 units per mil or U100 insulin, which is standard for most insulins. And it says it's a sliding scale based on the finger stick blood glucose. And again, there's the sliding scale. So when I chart this, I chart it's given, the date and time pre-populate, I chart that it's 2 units, and then in the comment section, I list the site, the abdomen, right lower quadrant, and the blood glucose level of 190. If you look at the sliding scale, between 151 and 200, which is where 190 falls, you give 2 units. I gave 2 units. The process is the same for IM injections or intradermal injections in terms of listing the site. Sometimes if you're giving an IM injection for pain, the pain level would go in the comments section. Just depends on what medication you're giving. So let's move on to IVs. First, we'll talk about IV fluids. For fluids, there is a rate involved, and this is the first time that you will be writing something in that box that says rate. The rate will be listed in the MAR in the administration instructions. The size bag ordered and hung will be the dose, so if it's a liter bag, it will be a liter or 1,000 milliliters, or if it's a 500 ml bag, 500 mils, that's the dose. The first bag you hang, you can chart that you started it, and then subsequent bags, you can just chart that you gave it. And then you can chart information on the IV site in the comments section. So if you look at the slide at the top, if you want to start the IV fluids, you click on the empty box at the time you wish to start them. So for instance, there's an order here for half normal saline, 1,000 mils to go continuously at 75 mils an hour IV. There's no time, they just want you to start the IV and hang the bag. So let's say, for the sake of argument, it's 8 o'clock in the morning, I started the IV and I hung the bag. So I would click on the empty spot where 8 a.m. is, and this would come up. So everything that you need right there is in the order, and then below that you can see that they dispensed 1,000 mils or 1 liter of the solution. Sometimes they'll call it sodium chloride for injection. That's how they sometimes talk about IV fluids. So if you look at the bottom where I charted it, you'll see that I started in the actions given the IV fluids at the date and time that's listed, and that pre-populates. The dose is 1,000 mils, which is the amount that was in the bag that I hung. The infusion rate ordered is 75 mils per hour. That's what I set it at. And then in the comments section, I say that the IV is in the right hand and the site is without redness, pain, or edema. There's a lot of different ways to describe an IV site, but if it's fine, just list the pertinent negatives, which usually have to do with color, swelling, or pain. Phrase that they frequently use is clean, dry, and intact, and I suppose that's okay too. Not quite as descriptive as what I wrote, but it's certainly acceptable. So this is for a primary IV infusion. If you are infusing an IV piggyback, say like an antibiotic, it's exactly the same process. The order will be at the top. It will list the drug, the amount of fluid the drug's in, the rate that it's to go in, and that it's IV. Then they will tell you what they dispensed, and then you will chart it exactly like I just did. The exception is there is medication in this, and so the dose here will be the dose of medication. So it won't be like 100 mils if the meds is in a 100 ml bag. It will be 1 million units of penicillin. So the dose will be the medication rather than the amount of fluid, and that's really the only difference in charting an IV piggyback. An IV piggyback is a secondary fluid infusion that is piggybacked or put in along with a primary infusion. Sometimes if people have a saline lock and we just use it to put in the antibiotics or the steroids or whatever it is medication-wise we're putting in, we'll also call that a piggyback. But what we mean is an infusion of medication, not a primary IV fluid. So when you give an IV piggyback, there are 3 important details in the order. You want to know the drug dose, which in this case it's 2 grams. You want to know the amount and type of fluid it's mixed with, which in this case it's 100 mils of D5, and you'll see that down in the dispensed area. And then finally the rate. And the rate is up above, so you'll see dose frequency, the schedule is there, 7, 15, and 23. The rate is 100 mils per hour, and the route is IV piggyback. Now, note that there is a dose of 2 grams. There is also the type of fluid it is mixed with, but there is no place to chart the fluid. It's part of the order. There's no place to put it in the MAR. Where the type and the amount, well, not the type, but the amount of fluid goes is in the intake and output chart. So when I chart this, I say I gave it, the date and time pre-populate, my dose is 2 grams, the dose of the drug, not the amount of fluid. And then the rate is what's ordered, which is 100 mils per hour. The comment I'm going to make here is about the IV site. It's in her right hand. It's without redness, pain, or edema. So this is just a little different than charting the primary fluid, where the dose was the number of mils of fluid contained in the bag. For a medication, we're talking about the dose of the medication, the antibiotic, the steroid, the heparin, the insulin, whatever it is, we're giving IV. This order is for an IV push medicine. IVP is how it is abbreviated. And it's different not only because it's IV push, but because it is STAT. STAT means give it ASAP and hurry up. Whereas you could also have the sort of the same thing be give it now. Sometimes it's ordered now. And that means what it says, give it now. They can be used interchangeably, but the STAT designation usually implies more urgency. You'll see a STAT or a now order, and they're like PRNs. They won't have the word scheduled on the MAR. You just chart the time that it's given. So you click in that little empty space. And a STAT or a now order is usually given for a reason, such as a change in condition, for example, a drop in the blood pressure, increase in the heart rate, other sort of vital sign, or a lab value change, or for a person whose initial presentation is serious. So for instance, if you get admitted for an acute respiratory issue, an acute cardiac issue, fluid and electrolyte problem, those orders will quite often be STAT or now. The reason for the order and the assessment changes after administration can be noted either in the comment section or maybe in a nurse's note or some other place in the chart, like for instance in the I&O here because you're giving a diuretic, or in the vital signs graphic if you're given a blood pressure med or whatever. IV push drugs like IV piggybacks or primary infusions usually have a rate ordered. It could be ordered in milligrams per minute, or it could just say push over X number of minutes, like push over 5 minutes, push over 10 minutes, whatever. The IV site condition, just like with the primary infusion or secondary infusion, also goes in the comment box. So if you look at our slide, if you have a STAT order, again, there's no time, so just pick the blank space for the time you're giving it, and then look at the order. IV push route with a normal saline flush before and after. Sometimes if you're pushing into someone who has a primary IV line running, you won't need this flush. But in this case, let's say there was no primary IV running, and so we have a flush prescribed before and after, and we'll talk about the flush in a minute. There's also a direction for the rate to push it slowly over 5 minutes. The rate is in the other, and it's listed in the comment section along with the IV site info, and the flush is charted separately. Flushes for an IV line can be ordered and charted in many different ways. They can be ordered every shift in PRN to keep a line patent, or they can be ordered at specific times, such as before and after a medication. In this example, the flush is given before and after a drug that takes about 5 minutes to administer, so the flushes can be charted at the same time. In other cases, the flush is given before and after a drug that takes longer to infuse. Say, for instance, an IV antibiotic that takes an hour to infuse. So let's say the drug is ordered at 9. The first flush would be charted at 9. The IV would be hung to infuse over an hour. And then when the IV is finished at 10, the second flush would be administered and charted. So let's go to our slide. Note that the order normal saline flush is written C administration instructions. So you go down to the bottom and it says every shift or as needed to keep the line patent. Flushing before and after this Lasix dose that we was on the previous slide would make it the PRN dose. Since the normal saline flush was given before and after the Lasix, and the Lasix was administered over a 5-minute time period, it can all be charted at the same time. And again, if it was flushing before and after an infusion lasting, say, an hour, you would chart it twice at the specific times you flush the line. So if you look here, it was given, 2 mils were given, and then if you look in the comment section, it'll say IV flushed before and after the IV furosemide. And then I give details about the site. When you click Update and go back to the MAR, you will see that your medication administration is noted in the MAR with your initials in the box next to the medication and under the time you gave it. You saw this in the oral medication video. If you hover over your initials, you'll see details for the administration, the time, the dose, and any comments. And if there are no comments, it'll say none. And so this is how you'll look at the MAR and know when people have given their medication. The results, it says here that there were no comments, but the results of a stat drug can be recorded, say, like in the intake and output log or the vital signs log or whatever. They don't necessarily have to go in the comments section. Finally, as we discussed in the oral medication presentation, if you're giving a drug for which there are parameters in the order, you will need to complete those assessments prior to giving the meds. And in this case, on this slide, it's insulin, and it's being given according to the sliding scale that we looked at earlier. And so the amount is depending on the blood sugar value. Sometimes assessments before and after a medication administration will be charted elsewhere, such as in a nurse's note, INO, vital signs graphic, whatever. We talked about that before. So if you have parameters, once again, always important to chart before and after, and you can chart your assessments in many different places in the chart. Just make sure they're somewhere. The nice thing about putting them in the MAR is that when a person goes to look at when the med is given and hovers, they'll be able to see in the comment, oh, I gave this for a blood sugar of 190. They won't have to wonder what the blood sugar is or go back to the vital signs graphic to find it. I hope you found this little talk useful in helping you to understand how to chart medications in EHR Tutor.